Can you get rhabdomyolysis from taking GLP-1 medications? You know them better as semaglutide, also known as Wegovy and Ozempic. Well, let's look at the evidence. Here's a report of a 36-year-old man who went to the hospital complaining of dark-colored urine and severe leg pain, which he described as being a 9 out of 10 on the pain scale. The man reported he was not exercising, but did recently start taking semaglutide for a month to help lower his body weight, which was 255 pounds. And to drill down a little further, he stated he was taking the medication at 0.25 milligrams once a week, but did increase it to 2.4 milligrams a week before his hospitalization. Medical tests revealed his liver enzymes were elevated and his creatine kinase level peaked at 25,000. He spent 5 days in the hospital, and the doctors also report that after a few weeks, he went back on semaglutide at a lower dose, 0.25 milligrams per week, and didn't have any relapses of Rhabdo. Here's a report of a 47-year-old woman who also had hypothyroidism and a history of blood vessel disease and aneurysm. She reported to her doctors that she had body-wide muscle weakness and pain and fatigue and difficulty getting out of bed, and this all started after she reported taking 2 doses of 1.7 milligrams of semaglutide. Now, what's interesting here is she was previously using another GLP-1 medication called liraglutide, also known as Victoza, without any problems. And in case you're wondering why she switched from liraglutide to semaglutide, well, that appears to be due to differences in her insurance coverage. Regardless, laboratory analysis revealed that she had an elevation in one of her liver enzymes, AST, that's more likely to increase with Rhabdo, and she also had an increase in her creatine kinase levels too. However, as you can see from this chart, the increase in creatine kinase was less than what other people may have experienced when they had Rhabdo. By the way, comment below and let me know what your creatine kinase level was when you had Rhabdo. Regardless of all this, once she was taken off the semaglutide, her creatine kinase level decreased. 4 weeks later, she was re-challenged with the semaglutide again at a lower dose, 0.5 milligrams per week, and didn't have any problems. However, as doctors began to increase that dosage back up to 1.7 milligrams per week, her symptoms began to recur again, even though, however, her creatine kinase level did not rise. Here is what appears to be a poster presentation from doctors at Ohio State University College of Medicine. This presents the case of a 56-year-old woman who was dealing with lupus, fibromyalgia, and other health issues, who went to her doctor after experiencing low energy and muscle pain 2 weeks after she started taking 0.25 milligrams of Wegovy, also known as semaglutide. Laboratory analysis revealed her liver enzymes were elevated, her creatine kinase level was almost 35,000, and they also reported an elevation in another enzyme called aldolase. Bottom line, the woman was diagnosed with Rhabdo. She spent 3 days in the hospital. She appears to have fully recovered, but the doctors don't say whether or not she went back on semaglutide again. I also want to point out that other GLP-1 medications may also be linked to the development of Rhabdo too. For example, here's a report of a 66-year-old woman who showed up at the ER with complaints of extreme muscle weakness, nausea, and vomiting 1 day after her very first dose of Tirzepatide, also known as Mounjaro. But here's the thing, the normal recommended dose of Mounjaro is 5 milligrams per week. This woman began with 15 milligrams. In other words, she started off taking 3 times more of the drug than was recommended, and if you ask why, the reason she stated was she wanted to lose weight faster. And what makes this case equally strange is that this woman technically was not considered to be obese. Her body mass index was only 25, which begs the question, what kind of doctor would be recommending this medication to someone who doesn't technically qualify for it? Regardless, her liver enzymes, creatine kinase, and myoglobin were all elevated, and she ended up spending 3 days in the hospital. Here's a report of a 35-year-old woman who's apparently healthy. She goes to the emergency room complaining of pain and swelling in both of her arms. She states that she has not been working out, and she's also not taking any prescription medications or supplements either. Rather, the only thing she was taking was Tirzepatide, which she had been taking for a few months. Laboratory analysis revealed her muscles were breaking down, her liver enzymes were elevated, elevated, and her creatine kinase level spiked to over 76,000. Obviously, she was advised to stop taking tirzepatide, and 2 months later, she appeared to be fully recovered. And here's a report of a 68-year-old man with type 2 diabetes and other health problems. He was taking semaglutide, but it didn't appear to be working because his hemoglobin A1C was still elevated at 8, and so the doctors changed his prescription and put him on 2.5 milligrams of tirzepatide weekly. A month later, his creatine kinase level began to rise. Now, once the doctors changed his prescription from tirzepatide back to semaglutide, his creatine kinase levels began to fall, and his Rhabdo symptoms began to disappear. So what does this all mean for you? Here's a few takeaways. Number one, yes, GLP-1 medications appear to be related to the development of rhabdomyolysis in some people, although the occurrence appears to be low. That said, we'll have to wait and see what happens as more people begin to take these medications. In some people, Rhabdo appears to be associated with taking too much of the medication or increasing the dosage too quickly. Also, this side effect appears to be individualized. In other words, in some people, semaglutide was triggering Rhabdo, although in others, tirzepatide triggered it, while semaglutide did not. As for why these medications appear to be triggering Rhabdo in some people, that's just open to speculation at this point. But if you got Rhabdo from taking a GLP-1 medication, definitely leave a comment below and let me know.